Most people assume their health decisions are based on what's best for them, but that's only true when everything is available, because the moment resources become limited, those decisions start to change, quietly at first, then completely. In a normal situation, managing your health feels straightforward. You feel something off, you go to a doctor, get a prescription, follow instructions, and move on. There's a system behind every step. A kind of safety net that most people don't even think about, but that system depends on something very fragile: constant access to medication, access to equipment, access to professional care. And when that access starts to break down, even slightly, the way people make decisions begins to shift. At first, it looks small. A delayed appointment. A medication that's suddenly unavailable. A pharmacy that runs out of something you assumed would always be there. So people adapt, they wait a little longer, they substitute, they try to manage, instead of resolve, and most of the time, they don't even realize they've changed their behavior. But over time, those small adjustments start stacking, and that's where things become more serious, because now, decisions aren't being made based on what's ideal. They're being made based on what's possible. Think about something as simple as pain relief. In a normal situation, you choose what works best for your body, but in a shortage, the question becomes different: what do I still have? That subtle shift changes everything, because now, you're not optimizing. You're rationing. The same thing happens with more serious conditions. Medications that require consistency, like insulin, suddenly become a source of stress, not because people don't understand their importance, but because supply becomes uncertain. So decisions start to revolve around preservation, stretching doses, adjusting timing, trying to make something last longer than it was designed to. And this is where the real tension begins, because every adjustment carries risk, but doing nothing carries risk too. So people are forced into trade-offs, constant ones, and most aren't prepared for that kind of thinking, because in stable systems, you're never asked to choose between less ideal options. You're given a clear path, but in shortages, that clarity disappears, and what replaces it is uncertainty. Now here's where it gets even more complicated, because shortages don't just affect access, they affect perception. People start questioning things they never questioned before. Can I take expired medication? Is there an alternative to this treatment? What happens if I wait? And suddenly, decisions that used to be automatic become deliberate, slower, heavier, more stressful. But here's what's often missed: these decisions aren't random, they follow patterns. The real issue isn't that people are making worse decisions, it's that they're making decisions without a framework, without understanding how to evaluate risk, prioritize actions, or adapt safely. So everything feels like a gamble. And that's the turning point. The real issue isn't the shortage itself, it's the lack of structure in how people respond to it, because when you understand how constraints change decision-making, the situation becomes more manageable, not easy, but clearer. Instead of asking, what's the perfect solution, you start asking, what's the safest option available right now? Instead of reacting emotionally, you start evaluating logically, what matters most, what can wait, what creates more risk if ignored. That shift doesn't eliminate the problem, but it changes how you move through it, and this is exactly what we've seen in places where medical systems became unreliable. People didn't suddenly become experts, they adapted, they learned how to operate within limitations, how to use what they had more effectively, how to avoid unnecessary risks, because when resources are limited, every decision carries more weight, and the difference between a good outcome and a bad one often comes down to timing and understanding, not perfection, understanding. And this is why more people have started paying attention to practical medical knowledge that applies outside of ideal conditions, not to replace doctors, but to reduce dependence on perfect systems, because the truth is, most people don't think about this until they have to, until something isn't available, until something changes, and by then, every decision feels harder than it should. If you want to understand how to think through these situations more clearly, there's a structured breakdown in the description that walks through real-world scenarios and how to approach them step by step. And if this kind of perspective helps you make better sense of uncertain situations, you can subscribe for more content that focuses on clarity over complexity. Because when options become limited, the way you think becomes everything.